The Arthritis Foundation is a phenomenal institution. It's a small institution that really reaches a lot of people. Last year in the United States, there's over probably 1 million joints a year done, total joint arthroplasty. That does not include all the patients that are actually affected by arthritis. If you look at the data, 50% of patients over 50 have some degree of arthritis. That's a significant number. I mean, 300 something million people in the United States, that's 150 million people affected by arthritis, and most people don't do anything about it. Arthritis Foundation is small but far-reaching. What that means is that anything they do, all the funds they raise go right back into circulation, into helping people with arthritis. They don't have big offices, they don't have big staff, they're helping you directly. And that's part of the reason that I think, I'm supporting it, and I think a lot of orthopedic surgeons support it. I mean, to a hip and knee surgeon, arthritis is basically the base of what I do. And Arthritis Foundation is right behind us in that. Being an honoree for them has been a phenomenal experience. I mean, you get to meet a lot of the people that are directly involved with the Arthritis Foundation. You get to meet other honorees. And when we think about arthritis, we think about, the 75-year-old lady or gentleman who's on their cane, stooped over because their knee and the back hurts. But that's not the case. A large portion of patients with arthritis are 17-year-olds that are hit by juvenile rheumatoid arthritis, juvenile forms of arthritis. When you're 75 and you're on a cane, that's hard. When you're 17-year-old in high school and you're on a cane, that's even a bigger effect. And when you see, what Arthritis Foundation does in terms of research, trying to find new medications and drugs to help arthritis victims, trying to provide even support, they will go out and buy medications for some of the patients that can't afford it. They sponsor the research, they help physicians, they help even with distributing information and acknowledging that arthritis is a problem and something that we can do about it. So considering that, I think it's been a great experience for me this year. They've done a good job in marketing arthritis in itself, which is something that everybody talks about, but nobody really considers, nobody really thinks what it means. And the funds really go out there and going right back into research. I mean, we're part of Lifespan, University Orthopedics. We do a lot of research in the state of Rhode Island related to orthopedics, related to arthritis. And Arthritis Foundation has been supporting some of that research in itself. But Rhode Island is just a small branch. I mean, over the whole country, it can make a huge difference. I mean, they're collecting millions of dollars that is going right back into helping patients. It's not something that for the future, it's for today and for tomorrow. Rheumatoid arthritis, regular osteoarthritis, post-traumatic arthritis, they're making a difference in terms of what they can contribute. And everybody can contribute. I mean, we are funding the Arthritis Walk, which is happening in June. It's part of the POTOX, and they're going to be right there with you. But it's not just that. I mean, they do things all around the year. They do dinners, they do galas, they do drives, they do all kind of fundraisers to, again, help arthritis. And anybody that can contribute can make a big difference.